As it was said, I'm Margarita Triguero-Mas. I'm at the Open University of Catalonia. We're creating a new university suddenly. I'm a senior researcher at the Open University of Catalonia, and I'm also affiliated to the BCN-UAJ, that is a research group of ICTA UAB, the Autonomous University of Barcelona, and also affiliated to the IS Global, that is the Barcelona Institute of Global Health. And today I will try to talk about a lot of different things. I got very creative when I was asked to provide a title. Green spaces, heat, health equity, housing, and environmental justice. So hopefully everybody's awake and my presentation will be clear enough. Basically, I will try, or my main aim is that when I finish the talk, everybody has had an exposure and has an idea about two specific examples of ongoing transdisciplinary projects on planetary eco-health. And I see Misha is there. Okay, so to start with, I wanted to connect my talk with the work that Misha brought, I think 2 days ago, Tuesday. That was planetary health. And during the questions, there were some questions to Misha about the differences between planetary health, One Health, global health. So I wanted to bring again the conversation, and Misha, correct me if I say something wrong now, reproducing the discussion or conversation. So when we think about health, there is individual health, that is the focus mostly of medicine, when we go to the GP, the hospital, we are worried about our own health. Then we have public health that goes a bit broader, and instead of looking at the individual, looks at communities, populations, and mostly public health looks as far as the health of a nation. Then we have global health that focuses on achieving equity for all the populations in the globe. So it's not focused only on nations, it's more looking at around the globe, all the population that we have, what are the main health issues. Yes? Then we have One Health, and here things get a bit tricky for me because I think there are a bit of different definitions about One Health, but most of the One Health research, I would say, has focused on the connection between human health and animal health. So it has quite a multidisciplinary approach, and basically is a lot about the interaction between veterinary and health sciences, medicine, etc. And then we have planetary health, eco-health, that are a bit different, but for me, I would say are there in the broader area. So planetary health would be focusing on this connection between human health and the health of the planet, and also having a focus on equity. So making sure that those whose health is worse will improve, their health will improve. Planetary health uses mainstream science, as we have been discussing these days, Western science, and it focuses on the sustainability for humans. So I would say it's very anthropocentric, which I'm not very proud about, but it's what it is. And then for me, the difference with eco-health is that it focuses on humans and the planet or ecosystems, but it also looks at animals and equity. But then the main difference with planetary health is that it feeds from mainstream science, but also indigenous knowledge, indigenous science. And then when thinking about sustainability, it not only focuses on the sustainability for humans, it also thinks about sustainability for animals and for the ecosystems. Yes, I see Misha saying yes, so okay. I would say my perception, and reading some new papers, it seems eco-health has gone a bit downhill. It is not, it's not so present in World Health Organization, UN, etc. And in a way, planetary health is a bit taking some ideas from the eco-health. So in the Planetary Health Annual Meeting that there was last week, there were a lot of talks from indigenous knowledge, indigenous science, so it's a bit, I think, trying to go that direction, but still being quite anthropocentric, I would say. I hope this was clear, everybody's, nobody's sleeping. So talking about how can we more specifically relate to how planetary health thinks about these changes in the planet and the health of individuals. So basically planetary health thinks and conceptualizes that there are different values, culture, behavior that impact the Earth system and make us impact, or humans have an effect on the climate, the biosphere, the atmosphere, the biogeochemical flows of the Earth system. That is what you have in the green part. And those effects impact the exposure that humans have to different environmental factors. So these changes to the Earth system make that we have different exposures to green spaces, to air pollution, to heat, etc. And these exposures to environmental factors through different modifying factors, like depending on our socio-demographic characteristics, the infrastructure, the healthcare system of the countries where we live, etc., will end up impacting our health and the health of our communities. Okay. Now I will go to present the first example, let's say. And the first example is about green spaces and non-communicable diseases. So the research about green spaces and non-communicable diseases have, human health has increased a lot in the last, I would say, 15 years. And this umbrella review from 2021 already says that we have enough scientific evidence to say that living closer to green spaces, so having green spaces around our homes, is related with lower odds or lower probability of dying prematurely, of having cardiovascular diseases, of having extreme values of blood pressure, blood glucose, or body mass index, and also lower odds or lower probability of mental disorders, low birth weight, physical inactivity, and sleep disorders. All this body of research that has been growing from mainstream science or Western science in the last 15 years, especially from environmental epidemiology and environmental psychology, has led or has helped do some health impact assessments that basically use scenarios to calculate what would happen in certain cities, contexts, if we would increase green spaces. So for example, in this paper, the authors calculated that if more than 1,000 European cities managed to have all their neighborhoods with at least 25% of the area being green spaces, we would have nearly 43,000 less premature deaths every year. And this is the kind of message that policymakers really like. So it's good to have these papers. However, this relationship between green spaces and health is not homogeneous. So not everybody is benefiting equally from having exposure to green spaces. And research has been showing again and again and again that those that are more underprivileged benefit more from exposure to green spaces. And I brought one recent example from one study in the UK where they managed to follow nearly 3,000 people during 11 years, very crazy, and knowing where each person was living during these 11 years. So they managed to calculate the exposure, the residential exposure to green and blue spaces during these 11 years, and they had access to medical records to assess if these people had been diagnosed of any mental health disorder during these 11 years. And basically the left side, what you see is the estimate for all the population together. So they saw that living close to green, blue spaces was associated with a 7% lower odds or probability of having mental health disorders for the whole population. But then what they did was to look at where these people had lived in terms of the deprivation level, the deprivation neighborhood level. And they classified people from those living the most deprived to the least deprived. And what I find interesting and what I wanted to show here is that there is a gradient here on this relationship between green spaces and mental disorders. So those that live in the most deprived areas experienced a higher percentage increase, a 10% lower odds of probability of having mental health disorders. While those that live in the least deprived, so those that are more privileged, only had a relationship of 6-7%. I see very confused faces. Should I explain this slide again? Okay. Okay, so based on all this, I wanted to bring one new project that we are doing. This is a Horizon Europe project that started in 2023 and will last until 2027. What we usually call the GreenMe project. GreenMe basically aims to identify in which ways we can scale up green care to improve adult mental health and well-being. I wanted to bring the project because it's what I spend 95% of my time thinking about, but also because I want to think it's a good example of how we are trying to move towards transdisciplinary research in planetary eco-health. So basically the consortium is 20 partners. 50% of them are the typical academic boring partners, and the other 50% are non-academic. So we have municipalities and we have implementers of green care. So you can imagine a lot of fun, but also a lot of frustration here to manage all these people and make things happen. And basically the way that we are approaching the project and that we design the project is in 3 stages. One stage to diagnose the status of green care in the different study areas. One stage that we call increase the scientific evidence, that would be the more traditional environmental environmental psychology studies. And then a third phase that we call empower the green care actors. And when we talk here about green care, what we are referring is to nature in everyday life that you see on the left. That is what I've been talking about at the beginning, and is what we have a lot of evidence about. So this exposure that you have to green spaces, blue spaces, when you go to work, when you go to get your kids from school, when you go shopping, etc. So this exposure to parks, gardens, street trees. But also we want to connect this type of exposure to nature-based health promotion. That would be, for example, if you do yoga in the park, you are not specifically going because you want to go to the park, you are going in here because you want to do yoga, and it seems to happen in the park. And then we also want to connect it to what is nature-based therapy. That is what you can get in some countries like UK. You go to the doctor, and instead of getting a prescription for getting certain amount of pills per week, you get a prescription to go a certain number of times per week to a garden to do horticulture therapy. So for nature-based health promotion and nature-based therapy, the evidence on this link between the exposure and the mental health benefits is a bit more unclear and not so strong. So we want to increase the evidence on that and connect it to the other type of exposure. And we want to do that because we really believe that our hypothesis or theory is that really connecting these different types of exposure, you can make sure that those that need exposure to green care or those whose health is worse will be able to benefit from green spaces. Like we have seen, for example, in Catalonia in Spain, an increase on talking about nature-based therapies, but a lot of nature-based therapies, you have to pay for them, you have to go to very remote spaces to get them, so obviously they are not very accessible for those that are single moms with 3 kids and 2 jobs. So basically how we can make sure that nature-based therapies are part of the healthcare system and that are understood as connected with the rest. And more specifically and methodologically, how we are doing that. With the diagnose phase, that is what we have already done. We have done a great literature review, reviewing nearly 600 documents, I think it is. And we have done interviews in the different study areas. I think 140 interviews, something like that. And we are in the process of analyzing all this data. And now we are in the stage that we call increased scientific evidence, and we are doing 2 different studies here. We are doing the typical, or near to the typical randomized control trial with 7 interventions in different countries. These interventions are nature-based therapy interventions that already existed. So there has been a long process to negotiate with them how this randomized control trial would look like and how they can adapt to have a common protocol between the 7 interventions. But we are there, we are collecting data slowly, but doing it. And also we are collecting information on the medication that people take and the visits to the doctor to do a cost effectiveness analysis. And then the other part that we are doing, that you see there with the sociological study, is more a cross-sectional study, asking people about their exposure to nature-based health promotion and their exposure to nature in everyday life, and mental health and well-being indicators. And then since the beginning of the project, what we have been doing is different workshops with implementers of nature-based therapy, researchers, policymakers, and we are talking with them about the data, the results of or diagnose phase in each of the study areas, and brainstorming with them what schemes or frameworks we can create in each of the countries to try to see these 3 types of exposure to green care as connected and to advance exposure to green care in terms of mental health equity in the different areas. Yes. Okay, now I will move to the other topic that I sent in my title, so I have to talk about it. That is about extreme weather events and health. And here I will focus on heat and the health of seniors. So we are seeing an increase on heat waves, wildfires, flooding around the planet. And what we see, especially with heat waves, is that the impacts of these heat waves happen particularly indoors. You see here, for example, with data from the 2021 American heat dome, 98% of the deaths happened indoors. Most of them were from older adults. And what is interesting is that in Canada, when they asked seniors how this event felt, seniors reported that they felt stuck. They felt that they were in a housing that was unfit for the climate conditions. They felt trapped because they felt that the rents were too high to change to another house. They felt that there was a lack of tenant protection for those that were renting. They felt confined. They said that they were fearing being evicted or their rent to be increased if they would ask for their house to be improved, to be more protected when extreme climate or extreme heat would happen. And they also reported to be left out. They said that the mitigation and adaptation interventions or policies were not thinking about them. And in fact, we see that a lot of interventions that different cities, governments are putting in place are inaccessible or have unexpected effects for older adults. We see that public cooling centers are unknown in a lot of places, at least in Barcelona. I think now people is getting to know them more, but for a lot of years people has not even known that they have a public cooling center, or they are inaccessible because older adults have issues to leave their home, or because there is no transport to go to these public cooling centers. We see that the early warning systems and the recommendations are not enough for older adults to really protect themselves. And we see that things like these building retrofits to improve housing are not coming together with housing policies. So they could they can lead to gentrification and displacement again. So here I wrote this Housing Equity and Adaptations for Tenants project. That is a project funded by the government of Canada. I was going to say of Catalonia, of Canada. Wishful thinking here. And the project started in 2024 and will finish in 2028. So here what we are doing is exploring this, the compounding effects between climate, housing, and the health of seniors in 3 sites in the global north. New York, Vancouver, and Barcelona. And what I will present is basically what we will do in Barcelona, because each site is designing the study specifically for what makes sense for the context. So in Barcelona, what we are planning to do is 2 different things. From one side, to assess the environmental quality, indoor and outdoor environmental quality that older adults are exposed to, and how this environmental quality impacts the health of older adults. So here we will use specialized sensors for temperature, humidity, and air pollution. We will have activity trackers to get information on physical activity, sleep, and sedentary time. And we will also give them questionnaires, obviously, to get health and well-being information. And then on the other side, we want to understand the strengths, weaknesses, threats and opportunities of the different interventions that are already in place for climate adaptation mitigation, or that policymakers want to put in place in Barcelona, and how these climate adaptation and mitigation interventions really are taken into account and may benefit older adults. So here we are designing a participatory action research with different policymakers, community members, and some researchers to identify if there are any specific interventions of interest. Then we want to do a policy analysis to explore if the policies we have so far on climate adaptation and mitigation are taking into account the adults' needs, preferences, values, and how they talk about adults, thinking probably, or the hypothesis is that just saying older adults, end of the story, they are homogeneous, everybody is exposed the same way, or live the interventions the same way. And then we want to do semi-structured interviews with older adults to really hear about their life experiences and how they are perceiving and experiencing these interventions. So I hope this was clear and not too much for 8:30 in the morning, and looking forward for the questions. Thank you.